Now, guys, if we will take somebody with myofascial pain syndrome and we'll start providing our therapy, we will bring muscles to the function, and with this we will prevent further pathologies such as herniation of disc, and of course we will slow down the process of osteoarthritis, spondyloarthritis within facet joints. This is what happened if there's a lot of young people today, due to vigorous exercise, developing arthritis, degenerative type of arthritis with the knee and the spinal joints, shoulders, because of overuse and not rehabilitative treatment. Massage therapy is a special post-event rehabilitative sport massage contains significant power of rehabilitation, prevention, rehabilitation of the side effects, management of microscopical scar tissue. And here, as you see, myofascial pain is a precondition of development of severe osteoarthritis, maybe spinal stenosis, and herniation of disc. But even in the case of herniation of disc and all this negative phenomenon, we can be very helpful. On my DVD number 1, I am proposing all these techniques. Difference. Now you will see a segment from my DVD number 1. I little bit will repeat it there. It was necessary kind of clarification, therefore I spent this time. You will view this fragment from my DVD number 1, and I will come back to you. In any case of lumbar spine disorders, given to the fact that lumbar spine have kind of lordosis, it's very important to place, as you can see, I place a pillow under stomach to avoid hyperextension. In some cases it can cause a reflectorial spasm, hyperextension. Don't forget, we will apply pressure, and we will potentially will increase a little bit the lordosis. Therefore it's important to put pillow under patient's stomach. The first step with both thumbs, kind of like you try to push away paravertebral muscles, or in circle motion, or just like this, 7-8 times from LS region. We'll work on paravertebral zones. Next step we will do, if this is unilateral irradiating pain, we will do on one side, but I do recommend to stimulate the unaffected side also. Petrosage number 1, and include glutes muscles. And in this case, as you can see, I little bit shift the glutes by performing petrosage number 1. I remove a little bit, and this is actually under glutes, location of piriformis muscles, and under piriformis muscles located find pathways sciatica nerve, and over-tense piriformis muscles can produce irradiation and sciatica neuralgia, and we will affect a little bit with petrosage number 1 also all this lumbar sacral region, SI, sacroiliac joint. We will perform petrosage number 1, approximately 5-6 minutes. Petrosage number 2, hand after hand. And 3-4 times on one location we go. You see, it's allowed me to stimulate deeply and deeply and deeply. And this is to awaken reflexes in the form of muscular relaxation with back of the fingers. But what is very important, to spinal process is not to touch. Just, you see, if you paid attention, my proximal phalanges moving really paravertebra, like this. This technical approach, initial pressure have to be applied, and again, about amount of pressure you have to consult your client, yeah, like initial pressure to ask him how the pressure, and after this to proceed to not to overdo. But in any cases of disorders mentioned above, if there's herniation disc or spondylosis involvement that produce painful symptoms in lumbosacral region, venous blood accumulation is like a part of these disorders. And venous blood accumulation in this region is an additional cause of pain production. We can pretty intensive to do something like this. Yeah, but I would like to recommend, in special, if this technique's not so familiar for you, to do slowly. One step to make sure that you locate it between paravertebra, but on the right side, not on the other side. Otherwise, it can cause injury. If, for example, we mobilize paravertebral muscles on left side of column, like in this side, you will stay here, and you will make sure that your phalanx located between on left side between spinal processes and paravertebral muscles, like this, and push away, like this, and push. Apply initial pressure and just stretch as much as possible, stretches including glutes, and including changing the direction a little bit under glutes muscles, mobilizing piriformis muscles. And again, this is very important techniques that, again, we're making sure we don't applying initial pressure on the spinal process. We just nearby. We exchange with the elbow, with tip of the elbow. We're applying initial pressure, and again, how much the pressure, it matches he can tolerance, and muscles don't protecting in spasm. Applying pressure, and we stretching like around pelvic, so it's like a butterfly pelvic, to stimulate piriformis muscles and to reduce tension and of course compression of sciatic nerve. In case if a trigger point will be detected, we have to flex our elbow, and in this case I do recommend to utilize, to prefer the stimulation of trigger point by elbow. It's a very massive presentation here. I hope that you enjoyed in general my presentation on this fragment. On my DVD number 1, I am proposing comprehensive approach to this, include trigger point therapy and etc. Additionally, post-symmetric relaxation, very important techniques, are proposed as well. Rehabilitative exercise. It's needed when pain sensation go down and the plus-minus alliance fascia and muscles is normalized. It is very important to implement exercise to build up a little bit muscle mass and to sustain a normal resting tonus.